Good afternoon and welcome to the, I guess it's the second quarter GDDS quarterly user group. Can't believe that it's already halfway through the year. Thank you all for joining us. This is your time for us to give you updates on the Georgia Discharge Data System and for you to ask any questions that you may have. We are recording this meeting and request that you keep your lines on mute while we have our discussion, but do feel free to unmute or use the chat box to ask any questions. Again, feel free to unmute and jump in and ask a question or give a comment at any time. I'm Leslie Stanovich, Vice President of Data Services, and this is...
And I'm Sharifa Navos, your Data Integrity Analyst.
So we're glad to have y'all here today. We will get started. We do have a few updates on the GDDS program. We have HeidiNet, which is the data upload portal coming soon, a refresh coming soon. Sharifa wants to talk about the 2025 verification process as we will be preparing to close that data in the next couple of months. There are a couple of member folder updates, and then we'll have an open time for questions and feedback. As always, I like to go over the Georgia Discharge Data System high-level overview of how the data flows. All hospitals in Georgia submit their data in the UB04 data format to our vendor, Heidi, and that data is taken through a series of quality validations and verifications, some automatic that are auto run, others that Sharifa and I perform manually to review the data. And then that becomes the Georgia Discharge Data System and is distributed to the Brain and Spinal Trust Fund Commission, the state of Georgia, as per the Georgia law, and the Agency for Healthcare Research and Quality, which is a research arm that we use to fulfill data requests, and also the Healthcare Cost and Utilization Project. And then, of course, we make all of this data available back to you, the users, through our Market Optics program dashboards and Care Optics dashboards. Sharifa, you want to review the submission schedule with us for 2025?
Yes. Good morning.
And then
or good afternoon, everyone. And so, like Leslie mentioned earlier, we are planning to close for good the 2025 database. And so we have a Q5, which is the final release, coming soon. I'm starting my verification process this month. So if you get any emails from me regarding some data issues, volume distribution, or even invalid bill types that I see, just know that you have until about mid-July to resubmit your 2025 data. A lot of you do it anyway, just going through, making corrections, especially to your fatal errors if it's above that 3% threshold, which I'll talk about later. And I'll give you some tricks and tips on how to do a quick review through HeidiNet, and then also how to kind of drill down on specific elements of your data to make sure that everything is in line, is valid, and you're submitting the most valid and clean data as possible, so that when we close, that's what we have to look back on. And so if you need that schedule, we can always send it to you, but it's also under the HeidiNet website in the documentation portion, so that you can keep track of all those deadlines. And for 2026, April is due on the 15th of this month. We just refreshed for Q1 2026, so that should be available probably next week for our Market Optics users. And so please remember, and thank you for those who have been submitting on time, but please remember to submit by the deadline. And again, I'll send you an email if for those of you who are a little bit late, to remind you. We usually keep it open for another week to make sure that everything is in.
Great. So as Sharifa mentioned, the March 2026 data should be coming soon to Market Optics. Also, the Q1 2026 limited data set for those who subscribe should be released the week of June 8th, which is next week. I did want to make a note that the present on admission flag was added to a separate table in the limited data set. So in the limited data set, you have IP_DX or OP_DX that you link to. And so especially in the inpatient table, there will be a POA column added. There could be some in the ED file as well, Heidi was mentioning, but the column in the OP and the unclassified files, DX files, will not be populated, so they'll just be blank. Also, I will be sending out this week the 2025 payer mix verification email, and I will send that to all of the uploaders, and a few of you have requested to be included on that email, and I will certainly make note of that. But we also send that to the CFOs just for verification. It gets another pair of eyes on your payer mix by inpatient and by outpatient, and that has proven helpful. I think this will be like the third or fourth year we've done that, and it's enabled people to catch something that didn't look exactly right and make that correction before we close in final at the Sharifa mentioned at the end of July. So if you have any questions or feedback for us on that, just let me know. Now, we did want to give you an update that Heidi is working on refreshing the upload portal. It's going to be a refreshed, modern look with smoother performance, more user-friendly experience. And this is just kind of the talking points that they gave us to give you the update on. We'll be giving you specific dates of when that is going to happen. It's most likely going to be towards the end of August, beginning of September, but did want to give you a heads up that a refresh is coming. And Sharifa also would like to.
Oh, yes. I've sent emails, and we got 2 volunteers to be testers for this new environment. And so if any of you on this call, we need 2 more if you want to be part of this. Any Heidi Net user want to be part of this group, we'll send you an email to let you know when the testing environment will be available, and then you can provide feedback just to make sure that everything is user-friendly, accessible, functioning as expected. And so I think we have about a week or 2 for us to send in those volunteers, and then you'll get an email with your information. So after this call or during this call, if you want to put in the chat or just let us know if you'd like to be one of those testers, that would be greatly appreciated.
Yeah, so if you want to put in the chat, if you're interested in volunteering to be a tester, we would really appreciate it. All right, Sharifa, you want to talk about the verification and data review process?
Yeah, sure. And so earlier what we were talking about Q5, so 2025 data will be, I guess, closing soon for good. So mid-July is when we review the past year's data and just kind of make sure everything is I guess complete, as valid as possible, with as least, I guess, errors or issues as possible. And so we do recommend that your, I guess, billing department or any department, you get together with them, with your vendor, to make sure that you're reviewing your data and make sure that you're making corrections and resubmit it. And so I have a little, I guess, a little checklist for you below where you can make this easier, by checking age, gender, race, ethnicity, because those are, do cause fatal errors. Review distribution there. That's easy to see. If you see there's a sudden spike or a decrease, or just zeros, you can kind of look at that and see, okay, what's going on with the billing or with the chart. You can make corrections that way. Make sure you look at your patient type, your swing beds for inpatient, psych behavioral data. Make sure it's included for those facilities who have swing beds, and make sure that you remember that swing beds must be entered with a separate MPI along with the correct bill type. So those bill types are listed there: 180, 181, 184, 185, and 187. And so if it's not being, or if it's not showing, it's probably because that bill type is not correct. And then you want to review your revenue codes that require CPT codes. That form is under the documentation tab in HeidiNet. And then your MSDRG listings, just review the distribution of those. And if you do this, you should have a good idea if you're submitting valid data that's useful and clean. You can go to the next.
Sure.
And here in HeidiNet, under the report section, as you see there in that screenshot, there's also a verification report in Excel format that kind of shows you what I just discussed. And then you can compare. The other side has the previous year and the current year, so that way you can see if your numbers and your trends and your distribution are pretty, are the same or similar throughout. If there's any spikes or surges or anything like that, you can see that. And I'm also using that to verify each facility's data. So if I see anything, I'll just send it to you for you to review, to resubmit. This also shows you your inpatient and outpatient fatal errors. So make sure that you're below that 3% threshold, and that you're checking to make sure that all is well. So again, distribution, volume, trends. As you can see in this example, there was a surge there under the primary payer for your commercial HMO. And so you would look, I would see that and look at that and send that to the facility and ask them what happened. Why did the distribution drop for, I think here it's Medicare, and then go under HMO. So maybe there was like a mapping issue or billing issue. And so usually facilities are able to get with those people, whether it be the vendor or that department, medical records or billing, and correct that and resubmit those months. And as you can see there, you have your edit summary, your edit detail. That's where you can see which patient chart has those errors, and then your verifications. All that is under the report section in HeidiNet.
Any questions so far for Sharifa? Okay.
All right, and so as we stated before, so these are what you need to be looking at, and I just kind of listed what numbers from the UB04 layout that your numbers need to be, I guess, mapped to. Some of the, especially like the number 6 and 7 for the race are different in your system than it is in our system. So just make sure that those are mapped correctly, for other and patient refused. Your ethnicity, make sure that if the ethnicity is not reported, to use 2 for neither Hispanic or Latino, because that does make a difference in seeing what kind of population we're serving. And then here's the list also of the revenue codes that require a CPT code. I think there's people in the waiting room.
Oh.
You can go to the next one. And so here's some HeidiNet best practices for online corrections. There is a status tab that you can use to look at your, in red, you'll see your error rate if it's above the 3%. And you can make online corrections. We do recommend you make the corrections in your system so that the system and what you submit has similar data. But if it's just one, record or 2, you can go online and click that correct button and just make the correction there. And Heidi will save all online corrections to be run one big batch at midnight. So when you make the corrections, you won't see it right away. You'll see it the next day. Unless you do need to see it right away, you can send me a quick email and I'll let Heidi know to run them manually. And here for fatal versus warning errors, just remember that your warning errors do not affect your fatal error percentage. And so they're mostly just informational, just to let you know, and you can go into your system and fix some issues that you see have caused a lot of warning errors. So the only warning errors that you'll see would be attached to their records with fatal errors. And so we do want to focus on the fatal errors because they should be within that 3% threshold. And you can see that in the edit summary And the edit detail, that second page will show you exactly which patient or record has those errors. And we do also recommend that you use Market Optics. So for our Market Optics users or users that have both HeidiNet and Market Optics, that's a great tool. That data table dashboard is a great tool to be able to kind of select different data elements and then look at your data that way. And you can select a specific time frame, just the time range. And then if you go to the next slide, it'll show you that data table has 5 columns, and you can select, what I was just suggesting, your race, ethnicity, gender, payer category, your month, and then you can have extract it as an Excel worksheet so you can have a better idea of where your data is and how it falls and what's changed and what issues, need to be addressed. And so we do recommend you use Market Optics as well for verification, making sure your data is as clean as possible. And so if you have any questions, you can contact me. I can pull all these reports for you, send it to you, or show you, where to go, or give you more tips and tricks on how to make sure that you're reviewing your data for 2025.
As I went back to this slide, also, it's just a good idea, I think, to use some of the visualizations to look at your payer mix, or to go to the demographics tab and look at your male-female ratio to your the different ethnicity, the race. It just gives you a visual idea to make sure that your data is in line with what you would expect it to be. And the other thing is that we've had users look at their service area and find or have questions about another facility's data, and that's always welcome and very helpful. We've been able to identify issues for other hospitals that they weren't quite aware of. So anytime you have a question about, does this look right, that this particular hospital is missing this service line, or the numbers just don't seem to jive for a particular month or quarter, always feel free to reach out to us, because your service area better than we do, and your hospital's data better than we do. We review all the data, but we can't catch everything as it relates to making market sense, so to speak. We have somebody else.
And I did see that Mark, did you see in the chat, Mark Hayes?
A couple,
Yes, wanted to be a tester.
Yeah, a couple of people that I responded to.
Okay,
We had 3 people. So
good, that's good. And so again, here for best practices, this is just a slide showing you how to delete files. And that's for resubmission, because we do prefer that you delete previous files so that you don't get any, bleeding over of bad data. But what happens when you resubmit, and that's something that's changed in HeidiNet, where you think you deleted, or you resubmitting and deleting, but you're deleting you were deleting the whole submission. So for example here, if you're resubmitting September data, deleting the old file will now delete the whole submission, because what happens is when you resubmit, it just overlays. So basically Heidi took away the I guess you don't have to delete to resubmit. You can just resubmit, it'll overlay the old data, but then when you delete that data file, thinking that you're just cleaning things up, because it does still show as loaded, you're actually deleting your whole submission. So just make sure that you delete the old submission first and then resubmit, to just make sure that you have clean data. And you'll see here how many files or records have been overlaid, meaning that it's basically a duplicate, or the replacement, it's been replaced. And so that's a new, feature in HeidiNet for our users that have been with us for a long time. I've seen a lot of people deleting things, thinking that they're just cleaning things up, but they're just, deleting everything. So make sure, best practice, delete everything, resubmit, and make sure your date ranges are correct.
Any questions regarding deleting files in HeidiNet?
And as Leslie mentioned too, we have our member folders that have been updated recently, mainly the finance folder. So we had our inpatient site, proposed rule, rehab, and skilled nursing facility for 2027. The IPPS proposed rule, cost report model, long-term care proposed rule, and your wage and occupational mix, the final report here. So all of these have been uploaded for those who have access to that member reports folder under the data tab in
On the GHA.
on the GHA website, and those people have had either a C-level or got a permission, email from C-level to get access to those folders. And there are a few under development. So whenever they become whenever they are loaded and become accessible, I'll send an email to those users to make sure that they are aware that it's in there.
All right, that is all the content that we had prepared. So now it is your time to ask any questions, give any feedback. So we'll just open it up to anyone. Does anybody have any questions or want to see anything on any of the dashboards? I could log in and pull it up.
Well, I have a question. Can anybody hear me? This is Matt.
We can.
Okay, this is Matt Coleman from Northside Hospital. Just questions. So, the LDS that will be released next week, but there's going to be a new column, and that's the POA column that's going to be just on the inpatient files.
No, I believe that column will be present in each of the tables, but it will be blank for the outpatient and the unclassified DX file.
Okay, thank you.
You're welcome. Good question. Anyone else? So our next meeting that we'll have will be our office hour on July 1st. That is a Wednesday as well, and it will be at 1 p.m. And that is the time when we get online and actually just start running data on through the dashboards. And if you have something specific that you would like to see, you can log on. We'll be available all hour to answer any questions, or you can just log on to see what other people are asking about. But it's just an office hour if you need help, if you're a new user, or if you haven't been on in a while and you need a refresher. That's a great opportunity for you to do that. We probably will have a data and technology committee. We haven't had any new business, but most likely we will have one in August for the data and technology committee. And then our next user group will be Wednesday, September the 2nd at 1 p.m. So you should already have that reoccurring invite on your calendar. We still, just to give you a little bit of information, are in discussions with Heidi regarding the enhanced outpatient data. If you'll recall, that was a kind of ongoing project that we worked with them on for almost 2 years, and we made those dashboards available for a year for everyone's use. We got some helpful feedback on that, that the zip 3 level wasn't as useful as we had hoped that it would be. Some of the dashboards, we had suggestions on the design and functionality. So Heidi has made some changes to those dashboards for Missouri. And if you are still interested in the enhanced outpatient, we've not extended our agreement with them to refresh any data into the updated dashboards. So that would take more of a commitment from GHA monetarily wise to do so. But we still are welcoming discussions about that if that's something that is wanted, is needed. Something that your hospital doesn't want to make the investment in on your own. That's was the whole purpose of us trying to provide an enhanced outpatient dashboard, is so that hospitals don't have to go it alone in purchasing that data. So I'll just throw that out there that, you can contact us if you want to have further discussions about that. Upcoming, again, we're just working on finalizing the 2025 data, and we will be closing or have closed the first quarter of 2026, and that data release will be happening next week, and also pushed to the Market Optics dashboards as well. On the Care Optics side, the which is our quality dashboards that some of you have access to, there is a new updated kind of all-in-one dashboard, quality dashboard that will include the hospital acquired conditions, the provider level measures, as well as readmissions, all in one dashboard. So if you're interested in hearing more about that, just let me know. We do have a Care Optics user group, and I don't recall off the top of my head when that next one is, but if you are a user, you'll receive that notification. Did we lose connectivity for a minute? We may have. Anyway, that is all we had today. I'll just pause again for a minute and then give you the rest of the hour back. Anyone have anything else they would like to share? Well, we will download the recording and make a PDF out of the presentation, and Sharifa will post that on the GHA website under the data services folder. So please let us know if we can help you in any way for a one-on-one session on using the data tools or in reviewing your 2025 data. We're always happy to get on a Zoom to do that with you. Hope you have a wonderful rest of the afternoon, and we will talk to you next month. Thank you.